Hello, everyone. Good evening to everyone. Warm welcome to all the new members. I have a wonderful patient of mine from January of 2023. So this is all of 23, all of 24, and pretty much all of 25. Almost 3 years later, this coming January will be 3 years. So pleasure to have you on, and you're one of my rare patients in a sense that we're going to hear from you in regards to your journey. You were very well read, and you went through a lot as you came to me. You were very well read. You knew exactly what you were signing up for. So let me go ahead and go into a little bit more detail. When did you get your implants?
I got my implants in 1994.
1994. And they were what type of implants?
They were saline implants.
Yes.
And they were the Allergan, back in that day, they were actually McGann brand.
McGann, yes.
And they were the BioCell macro textured implants.
Yes, the textured. Now, back then in 1992, you could only get the saline implants because the silicone implants were banned. Later on, you could get silicone implants if you were part of an experimental study. So anytime someone talks to me and they're like, I got implants in 1996, and I say, you had saline, it's like, how did you know? I said, because you had to be part of an experimental study, and back then they had not started those studies, so saline implants. So you just had the one set.
Correct.
Yeah. Now let me ask you this: as you came to me, what led you to kind of seek a consult? In the latter part of basically 2022. It's like, how did you hear about breast implant illness?
Well, in 2019, I actually had heard about the FDA recall, and somehow I had managed to keep all my paperwork on my implants. So I did a check and I looked at the serial number on my paperwork, and I realized that, oh my gosh, I actually have these breast implants in my body that are recalled by the FDA. And so I started looking into what my options were. And I actually live on the west side of Michigan, and so I started looking at some plastic surgeons over there and had a couple of consultations. Didn't really feel comfortable because I was looking for a surgeon who would just remove the implants. I wasn't wanting to get new implants put in, and at that time I was being told that I could have them removed, but I was being encouraged to have them replaced with a new set of implants, and I just wasn't comfortable with that. I'd had them in my body for about 26 years at the time, and I'd kind of gone through my phase of wanting them and enjoying them, and I was just comfortable with my body not having them anymore. So after about 2 years of consulting with 3 different plastic surgeons and not feeling like I was going to find anybody that was listening to me and would go down the road of explant without replacement, I found a group online on Facebook. A friend of mine had pointed me in the direction of this Facebook group, and through that Facebook group, I started looking at some information, and I came across your name and a couple of other plastic surgeons. And so I started doing my own research, and I decided to give your office a call. And I looked at your office and another plastic surgeon, and I came over to this side of the state, and I met with you and the other plastic surgeon, and I was very, very happy with our consult and all the information that you had to give me. I was very comfortable, and so
Sure. Now, a question for you is, you said you had received information in 19 about the textured implants.
Correct.
Now, remember, France stepped up and they said they're going to ban, quote unquote, no more textured implants, and then the US kind of followed suit. Now, what they did was, Allergan back then, they said you don't have to necessarily remove them per se.
Right.
Did you notify that textured implants are associated with that rare BIALCL? And so they did not tell the patients, go and get them removed like now. They said, if you're hurt and you got the symptoms and you have the hurt, we just want you to be aware that there is an association between the textured implants and then also that they're implicated in that BIALCL. Now, if you can show me that paper right here, yep, this is the top one, yep. So what I want to do is for the listeners, this is the black box warning, and you can Google this, just go to Google, and this is also what I would recommend, reading this, breast implants, certain labeling recommendations to improve patient communication, guidance for industry and Food and Drug Administration staff. And so this is the black box warning, if you will. This is kind of, if you will, what is written on a cigarette box about, can cause heart attack and lung cancer. This is the black box warning on the implant box, if you will. And it says, quote unquote, breast implants have been associated with the development of the cancer of the immune system called breast implant associated anaplastic large cell lymphoma, which basically means had the patient not had the implants, they would not have gotten the lymphoma. So it's a direct association, cause and effect. This cancer occurs more commonly in patients with textured breast implants than smooth implants. So that means the textured implants are notorious. It's causing the inflammation, it's more reactive, and clearly, anecdotally, from my experience, whenever I've removed a textured implant, it is certainly more inflamed, more irritated, more angry, if you will, than smooth. And it says, quote, this cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Now, a year later, the FDA stepped up and they said there's another BIA-SCC, breast implant associated squamous cell cancer. Now, clearly, we know approximately 1,300 cases to date all over the world have been found in patients with implants. Now, one will say, well, this is not too big of a number. Now, remember, the FDA and the Plastic Surgery Society and the doctors will tell you one thing for sure. This is underreported, meaning there are a lot more cases that we know that are out there that exist. So that, unfortunately, what is happening today is a lot of surgeons are just replacing the implant, so they're not touching the capsule. Number two, the many surgeons who are even removing the capsule, let's say that small subset, they're not sending the capsules off to pathology. I see another explant surgeon, he's just cutting a small piece of that capsule and sending it off. No, you have to do a good representative sampling of that capsule so that we can find out if there is CD30 positive or not. So not all the surgeons are sending the capsules off. Even if they are, they're not doing a CD30 analysis, or they're not demanding a CD30 analysis. And so now those cancers are being, quote unquote, lack of a better word, missed because they're not being appropriately worked up. So every surgeon has to assume, to be complete, if you're the president of the US and you're getting this explant, they're going to do a CD30 analysis. So 3 of my own patients in the last year and a half have had CD30 positive. And I would not have known about it had I not demanded the pathologist to do the CD30 stain. So let me give you an example. The Trinity Hospital right across, I talked to the chief of pathology, and when we moved here a couple of years ago, I required that they do a CD30 analysis. Now, the pathologist, very nice, he said, do you not think this is overkill? The insurances might say it's unethical and unprofessional to do such a comprehensive analysis on all capsular tissue. I said, do you think if I send you 1,000 capsules, because you're not doing the CD30 analysis, are you going to potentially mess on lymphoma, BIA, LCL? He said, sure. And that's why I said, write down, I demanded as the plastic surgeon that this capsule must be studied for CD30. We need to rule out malignancy, BIA-SCC, which is the squamous cell cancer, BIA-ALCL, breast cancer, anything abnormal. Refract light on this to see if there is crystals of silica, histiocytic cells, chronic inflammation, the negative and positive. And so going back to your point, the textured implants clearly are implicated in more inflammation. So I talked to another senior plastic surgery colleague who's been doing implants for 40 years. He's been putting them in. And he said, clearly, I see anecdotally that there is more inflammation in patients who have textured implants, even though they're the nicer, better, safer saline implants, right? Now, the same hurt that you get from saline implants, you get the same hurt from silicone implants and ruptured silicone implants. So if I have 1,000 patients that walk in with saline implants, implants, smooth saline, textured saline, smooth silicone, textured silicone, I cannot tell which one is which from their symptoms. So you have to assume, just like a cigarette is bad and a cigar is bad, they all are implicated, some more, some less. And so the other thing it mentions here is this cancer occurs more commonly in patients with textured implants than smooth implants, although rates are not well defined. So they're saying smooth implants too. So it's not like smooth implants are safe. So this is important verbiage and again, lawyer language that they write, that they're trying to alert you as a consumer that they've been implicated. So they never told you, otherwise there were going to be a mass panic, right? And indeed, when that warning came out, I talked to a lot of my friends and they said there was a huge wave of patients coming in wanting to get their textured implants removed. And just like, now going back to this, was it just the fact that they were textured that alerted you, I need to take them out? Or was it the other symptoms that you were going through?
I had been battling a lot of symptoms that were completely inexplicable. Nobody could tell me what was going on. So shortly after I implanted, probably back in 1998 or so, I started having just random allergies. Just all of a sudden I started having random allergies to foods and random rashes. And I started having sinus infections, and I would get sick every spring and every fall, and that was not the case before I had my implants. So
and you're young.
I was in my early 20s
Yeah.
and relatively healthy my whole life prior. And suddenly I just started feeling ill. I started having fatigue. It was always, I had a child when I was 22 years old, so it was always, oh, you're a young mother, you're working full time, it was always excuses, just that I was a young working mother and I was busy, and that's why I'm tired, and that's, but there were no answers for anything. And so for 2 decades, it was just kind of on and on with this, no answers, but never feeling well, having more and more symptoms. Then, fast forward to, okay, now you have adrenal fatigue, and I had joint pain, and I was starting to lose my hair was thinning, and brain fog. And you have a list on your website that's amazing. That's got about 55 symptoms of breast implant illness symptoms, and I could check off, before I had my explant surgery, 52 of those symptoms that I had. And after I had my surgery, within the first month, I was down to, I could check off, I think, about 22 symptoms. So I literally went down almost 28 symptoms just in that first month post, surgery. If that tells you anything,
right. Now your case, I reviewed your chart and I remember you vividly. I remember all my patients because I spend all the time with my patients. So you had what was chronic fatigue syndrome, and you also had what were chronic pain issues.
Chronic pain and inflammation.
Yes.
I think just my whole body was inflamed, and even to this day, I still have all these symptoms that I finally have some diagnoses of rheumatoid arthritis and Sjogren's, but I still have some inexplicable gastro symptoms and things that, we don't have a diagnosis for them, but it's, inflammatory things. And I think it's 29 years of having these implants in my body that just did the damage that they do. And, it's been, 2.5 years since I explanted, and I don't know where it comes from, but they say, expect your recovery to be maybe 1 month per year of having had those implants in your body. So I'm somewhere in the recovery zone of, hopefully I'll, be feeling the best I've ever felt. And I am feeling much, much better.
Sure.
As every month, moves forward, but I'm still working on my recovery.
Yes. Mark, can you pull up that sheet of symptoms, please? I saw it earlier with the board. Now, I just want to go ahead and mention, so I just saw a patient today who's on a chronic pain pump, chronic pain syndrome, seen by a pain specialist. And as you will see, now this is again part of the black box warning. The black box warning, if you ask me, has a lot of information in it. So the third line, it says, Third point, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, so myalgias, confusion, which is the brain fog, chronic fatigue, which is what you had, autoimmune diseases and others like Sjogren's, dryness of the eyes. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution, that is cure of symptoms when the implants are removed without replacement. So this is very real, the chronic fatigue syndrome, and this is very real. Now what I want to do here is, this is your symptom list. This is what you were talking about, all the symptoms from, you had chronic fatigue circled, brain fog, muscle aches, pain, weakness, joint pain, soreness, hair loss, dry eyes, dry mouth, hair thinning, weight gain, slow healing of wounds, temperature intolerance, autoimmune problems, night sweats, skin rashes, insomnia, estrogen progesterone imbalance, swollen tender lymph nodes in the breast chest area, tingling numbness in the arms and legs, burning around the chest and breast, cold discolored hands and feet, muscle twitching, vertigo, dehydration, always thirsty, frequent urination, chronic neck and back pain, photosensitivity, nail changes, rashes that you mentioned, edema around the eyes, premature aging, thyroid, adrenal problems, dryness of the eyes, which is the Sjogren's, slow muscle recovery after activity, gastrointestinal digestive issues, sudden food intolerances, chemical sensitivities, persistent infections, suicidal ideations in you wrote I have, shortness of breath, symptoms of fibromyalgia, feeling like you're dying, chronic inflammation, recurring sinus problems, throat clearing, cough, headaches, dizziness, anxiety, panic attacks, mood swings, emotional instability, depression, symptoms or diagnosis of Lyme and ringing of the ears occasional. So these were the symptoms that you checked off, and this is where you had gone to your doctor, and that you had gotten, what is that, clean bill of health, that you're otherwise healthy.
Right.
Now, let me ask you this question. Now, let me go ahead and jump into this because you're gonna find this very interesting. Going back to this same guidance for industry published by the FDA in September 29, 2020. If I go to page 14, now remember, there is silica that is diffusing from the silicone shell of that saline implant, because the shell is made up of silicone. Mark, if you can pull up the pathology report in here, or maybe you might need to print it. So you have that silica from the silicone shell of that saline implant. And I'm going to page 14 up at the top. I did not write this. This is written by the FDA, their doctors. This is a recommendation that they have. Guidance for industry and Food Drug Administration staff, breast implants, certain labeling recommendations to improve patient communication. So they want you to sign, i.e. the patient to sign that they have read this. Quote, I understand that silicone can migrate from my implant into nearby tissues, chest wall, lymph nodes under the arm, and organs, liver, lungs, where it may not be possible to remove. I understand that all breast implants can interfere with mammography and breast exams, which could delay the diagnosis of breast cancer. Mammography can also cause the breast implants to rupture or leak. I should tell my mammography technician about breast implants. Now this next line, I understand that all breast implants contain chemicals and heavy metals. I understand that most of these chemicals stay inside the shell of the implant, but small quantities have been found to diffuse gel bleed through the implant shell of the silicone gel fill implants, even if the implant is intact and not ruptured or leaking, because yours were intact. So what has happened is that silicone has leached out into the periphery, and God only knows, maybe into the lymph node, and I do not know, but this is what I know from the other pathology reports, that they have had patients who had an MRI, it showed silica in the lymph nodes. Another that showed silica within the mediastinal lymph nodes, because remember, it's draining into the periphery. That's the body's immune response. There are case reports by Dr. Atul Mehta where they showed in saline implants, the silica is embedded within the lung tissue. So it goes into the blood and then deposits into, and they saw this by ground glass opacities and energy dispersive x-ray. So this is very objective, clear. 1 + 1 is 2, that kind of evidence. So there is no denying the fact, and they said this had to be that silicone leaching from the silicone shell of that saline implant. Now, this is that 1 month that goes by for every year. Now, this is where, remember, the only detox that a patient can go through is complete, sincere removal of the entire implant, the capsule, and all of that inflamed tissue in what is the en bloc fashion. So if there is any fluid, it's all removed, or 100% total capsulectomy. So you got the best surgery because there is no going back and removing anything more. And that the entirety of the implant capsule and all of that inflamed tissue is removed such that when we look back at it, there was no capsular tissue remaining behind. And that is the surgery that you got. And this is where you see the dramatic recovery. Now, as you will see, that you got your pictures and the videos.
Yes.
Yeah, so this is very important. The surgeon must and should and has to and should be, I use the word proud, and should, to be complete, transparent. Give the high definition pictures, 3, plus a video of the right chest wall showing complete removal with the right light, high definition, usually an iPhone camera with its 4 or 5 cameras that will highlight high definition, maybe 1080. You will see the raw muscle, you will see the intercostal muscle. That is the ultimate and the only proof. There is no HIPAA violation in me giving you own pictures and videos, because that is the bond that you had with me. That is the confidence that you had. That is the whole gist and goal of the surgery. So your surgeon cannot say it's a HIPAA violation or we cannot take pictures. Remember, plastic surgeons take pictures all the time, before, during, and after. If you want to tell a plastic surgeon entering a building, you will see he will have a camera, not the ENT, not the general surgeon, maybe the trauma surgeon would, but the plastic surgeon always will carry, and this is their job. We take pictures before, during, after, be it skin cancer, be it the big flaps, be it the dog bite, or be it the explant, because that is the only and the ultimate way, not only of the chest wall right, chest wall left video, but cutting open of the implant capsule on the table so you know exactly that it was removed in the manner as described, and that all of that capsular tissue was sent to pathology, because that way, if you want the proof that the entire capsule was removed, you can go to the pathologist right now and they have your sample stored and you can actually visualize and touch it, so you will know. You will know that the entire capsule was removed because you got the high definition videos. You will know that the capsule was removed because the surgeon spent the 4 hours plus minus. You will know your surgeon removed the whole capsule because he or she is a believer and talks about breast implant illness and does not like to be in hiding. That he or she is not augmenting, and that he or she is sending the capsule off to pathology, and is a true advocate, and he is only explanting. And not only he, but his partners, all of them. Because this is unfortunately what's happening in today's world and age. There are surgeons that are coming forth, I'm only going to explant. And anyone who wants to augment, they divert that traffic over to their colleague who's taking care of all the augmentation. So now they're able to market that surgeon who's explanting only better. Now, let me go back to you and ask you, as you went into your surgery was on the 4th of January, 2023.
Yes.
So at New Year's 2023,
Yeah.
how sick were you out of 10? 10 being the worst bad with the chronic fatigue, pain syndrome, with this all those symptoms of 55 except for the few. How bad were you out of 10?
At least a 10.
Really?
Yeah.
Okay, so you were hurting.
I was very, very sick.
Yes.
I was hurting. I was in the worst shape. There's a picture that I have. I wish I would have brought it with to show, but there's a picture of me the night before I came to your former office for my surgery, and then the very day that I went home from your office of my surgery. And you can see, I mean, it's almost like 20 pounds the night before, and then 20 less pounds the day of the surgery. Just the
inflammation on the face, yeah.
It's unbelievable. It's like a whole new person, like that walked in and that came home the next day.
So let me ask you this: if you were a 10 on the morning of the 4th when you came in for the surgery, how much out of 10 being the worst bad, 0 being like you're a teenager, how are you subjectively?
Today?
Yeah.
Today, I would say I am definitely like between a 1 and a 2,
Really? Okay.
honestly.
Yeah. So this is where, I will tell you, whenever I do any of these Facebook Lives, you ask any of my patients, they're on the spot. There is no rehearsal. You have no idea what I'm going to ask you. It's
Nope.
all from your heart. And remember, you came in and you want to share your journey because you know what? You will touch another patient's life.
Absolutely.
Now, let me ask you a question, not a trick question. When you went into your surgery the morning of, 100% of the patients are nervous and anxious. How well did you know that this surgery was going to help you?
I had blind faith, I guess I could say. I knew that keeping the implants in my body was no longer an option. I could not have them in my body. I mean, I couldn't even lay on my stomach for 30 years, 29 years. I just couldn't do it. It was so painful with those implants in my body. And again, I was having changes, so I think it was the right one was enlarged, maybe the left one, I don't know, but one of them was enlarged, one of them had flipped. I mean, there was so much weird stuff happening. We were concerned about maybe having the BIALCL. I had every single symptom of it. There was so much going on with my health. There was not an option to keep them in. So I was terrified. I was terrified to lose them. I was terrified to have the surgery. I was terrified to have them in my body. I mean, it was just like full blown panic. But I was here and I was ready and it had to happen. So here we were,
Yeah.
and we did it.
Yeah.
And it was really like, it was the best thing I've ever done for myself. It truly was. And working with you was the best possible.
No, thank you.
Ever. Thank you.
I will tell you, I'm blessed and honored. It is, I wish, for me,
Truly.
see, the reason why I got into medicine is to help. Now, when I did plastic surgery, there is a lot of help you can do. Plastic surgery has 3,000 operations. You can help dog bite victims. You can do hand. Hand is almost 1/4 of plastic surgery. If you can do hand, believe it or not, explantation is a piece of cake, just to be honest, because the hand is very tricky. Now, I remember all the textured implants that I have done. I remember you vividly, and every case is a challenge. Now, what's interesting is last week I took care of a nice patient from California. She came to me exactly 3 weeks ago. Today, she reached out to me for her phone consult and she said, I just got an MRI. It shows bilateral ruptured implants. So as I started off last week, you look at the whole week ahead of you. And I said, the toughest case is going to be that patient with ruptured bilateral silicone implants. And so, believe it or not, that turned out to be the simplest and the easiest of all the cases last week.
Wow.
And you would think that would be the hardest, and of the 7 or so that I did. Now, the bottom line is you never know what you're going into. Now, this is where you have the pathology. The pathology report is here. This is the pathology report. Fibrous capsule, which is scar capsule with dystrophic calcifications, meaning you've had them, so the calcium deposited. And this is read by Dr. Paul Mazzara, 1/4/2023. And then basically, relatively speaking, this is the information I gave them. Right breast implant capsule, left breast implant capsule, history of breast implant illness with chest pain and discomfort, rule out silica, rule out breast cancer, rule out BIALCL, CD30 analysis. And then they basically go over the length of the capsule, which is 15 by 6.5 by 2. And again, 14.5 by 8.5 by 2. Remember, the pathologist has to measure with the ruler as to what are the dimensions. Now, what's interesting about your pathology report, it's like a very boring, benign, like nothing wrong, next. Now, I will tell you, this doc who reads it, now he's ruling out breast cancer. Now, as you can imagine, some people are like, oh, I got so much work, I'm gonna read it fast and you're done. This reading is complete, it's thorough, it's final. Now, remember, we want to make sure that they're going to, and now I know he's very meticulous, he's read a lot of hundreds of my patients. Now, there's another doc, for example, just like surgeons,
Mhm.
just like a car driver. This person is A plus, this person is A minus, this person is B plus, this person is majority of the times good, but you never know depending on the snow or ice. Likewise, when it comes to a pathologist or a cook or a hair salon expert, right? You will see everyone has their own expertise, right? Now, going back to this pathologist, you would think they would write down bad cells seen, histiocytic cells, giant cells, refractile material. And so the pathology report is like very boring and benign, just dystrophic calcification. And this goes on to showing you, you may have a benign appearing pathology, but clinically look how much you're hurting. Now, let me ask you this. If you were 2.5 months out, I would say it's a placebo effect, or someone else would say it's a placebo effect. This is almost 3 years shy, 3 months almost, right? And so you are almost at the 3-year mark. So this is enough time has elapsed, and this is not a placebo effect. Now, having said this, if someone says that this is all in your head, this improvement, all of this is, subjective, and that, this might be something else. Maybe this might be another ailment that you improved upon. What would you say to that person?
Tell it to my bank account. I mean,
Yeah.
the tens of thousands of dollars that I spend on healthcare trying to find the answers and the treatments and everything that I have to do. I mean, it's definitely not all in my head.
I will say this to you. If anyone wants to, just look at your face before and after,
Yes.
and you don't even have to speak a word. You see? And so I will tell you, I will never forget this. One of my anesthesia team members, he looked at me and he laughed so hard. And these laughs are not benign because you never forget. And he's trying to make a mockery out of you. He's like, what are you trying to do? The whole world is wrong and you are right, Dr. Khan. And you're trying to make and prove everyone wrong. What do you think of yourself? You sound a little bit cocky. And guess what? Within his lifetime and my lifetime, almost more than half of the surgeons in the United States are offering explants, right? And he came up to me after the black box warning and he said, I take that back. And I told him, just go look at the patient's before after faces and you will see for your own eyes, the patients have nothing to gain.
Right.
You're doing this all on your own from the goodness of your heart because you're going to make an impact on another patient's life. And guess what? He himself, I saw him at the last year's winter party, and he came to me, he said, I watch you every single day you do the Facebook Live, and I always laugh at myself that I questioned you, And I told him subjectively, he used to make fun of me, and he's like, and this is, in the world of medicine, there are, these are, quote, the bad humor that we have, or the, sometimes it is a teasing humor. But I will tell you, my own friends who are plastic surgeons said, are you trying to tell me you remove implants and the vision improves? Or the dryness of the eyes or the GI symptoms improve? Now, let me ask you this. You had the chronic fatigue syndrome. How much fatigue do you have now?
It's not the same as it was before. I mean, obviously I still have my days, but it's nothing like it was before. Before it was just this heavy fatigue that also involved like the thinking, like, where it's like the brain fog and it involves your whole entire body, your mind, everything. You're just chronic fatigue like every day, day after day. And I would have days and almost like weeks at a time where it was like I could hardly get out of bed, I could hardly focus, I could hardly function. And I don't have that anymore. I literally don't have that anymore. I can get out of bed every day. Yeah, of course I have times when I'm tired. Of course I have days when I'm more tired, but it's not like day after day after day when I'm struggling to get through every single day.
The most common symptom the patients tell me, and this is very well seen on the Facebook group page, is fatigue. This is by far the most common symptom.
And it's like a debilitating fatigue. I mean, again, it's like one thing to feel tired. Everybody feels fatigue here and there. But this is like a debilitating, just inexplicable
The
thing.
patients say that they slept 8 hours, 10 hours, and they could sleep another 2. They don't want to get up to go to their own kid's birthday party, for example. These are young moms. Believe it or not, I have a 71-year-old patient that I talked to, and believe it or not, a 77-year-old patient right today in clinic, she said, I'm fatigued. And I said, the whole world probably says, guess what, you're 77. She said, I know my body. At 77, I know I'm high function, high energy, and I know something is slowing me down, and it's these implants. And lo and behold, you have heard this. My 89-year-old patient that I operated on in April of this year, her daughter just reached out to me last weekend, and she said, my mom is doing so much better. She just out of the blue wrote that, and she's sleeping a lot less. She's much more energetic. She's playing cards and all of that. I'm going to try to get her in to do another, she did one already. So we're going to do like another Facebook Live so we can hear from her directly. Because who would want to operate on someone 89? But guess what? She had the chronic pain, and that met the indication to proceed with surgery. And she had what was one of the worst cases that I have done, where she had a lot of masses and fluid within the chest. Now, let me ask you this, Melody. What would you say to someone who's thinking about getting an explant or wanting to get implants?
Somebody who's wanting to get implants, I would just say, make sure you know what you're getting. Make sure you know what you're doing. Make sure you know what you're putting in your body. Do your research. Talk to me, talk to any of us who have implants. You're gonna get different stories from different people, but just know what you're doing to yourself. Know what you're doing to yourself. Not everybody gets sick, but many of us do. And once you're in it, you're in it. A lot of women get sick right away. A lot of women takes 10 years. When I had my implants put in, that was, back in 1994, and I didn't get the message that you have to have them replaced every 10 years. So make sure that you get that message and that you follow it if you do get the implants. And if you do go ahead and get implants, make sure you have Dr. Khan's information in case you do get sick and you want to get them removed, because he is the best. He's the best explant doctor out there.
Thank you.
Honestly.
What we want, this is ultimately the goal. And, we need to see, as a explant doc who's removed a lot of these implants, and this is my entire practice, removal of saline implants, silicone implants, and residual capsules. If I could, in my mind, now remember, I can only do 250 of these in a year. That's where I cap. If someone in California, in Texas, in New York can reproduce this would be the ultimate goal. Number one, I want, and if I could, and remember, this is pure transparency, and this is part of the informed consent. And realistically, if this could happen, this would be, quote unquote, the true check and balance. A Facebook that is open, that allows for the surgeon's previous patients to post all the pictures, high definition videos, pictures of the chest wall and cutting open, not for one case to every case. This is what I do with almost all my cases. I walk in and I tell the patients, get your iPhone out, and I want to airdrop those pictures, high definition, before I even examine. Because this is part of the informed consent. So every surgeon gives high definition pictures and videos to their patients. So that is the ultimate of proofs. That the entire capsule was removed, the capsules are sent to pathology, that there's complete transparency with that. I see some surgeons who say they're going to get an explant and a lift and fat grafting in 2.5 hours. I will tell you that is virtually impossible. This is like flying from here to California in 1.5 hours or 2 hours. It is impossible. Just me explanting is a plus minus 4 hours. Number two, so look today, I have had the dominant effect. The case that I had this morning, both ruptured implants. And as I came here, I was an hour late almost, and I made you wait an hour for this Facebook Live. Now I spent all the time, I just saw like 6-7 patients. That was my whole day. It was one-on-one attention, not my physician assistant or my nurse practitioner or my resident. I have no residents that I work with, not my nurse. I did all the talking before, during, and after, and I'm very much heavily involved. This is where the surgeon is engrossed. So going back to the point, the Facebook page where all the patients, all discuss openly without any bias, direct messaging, phoning, interacting with the surgeon's previous patients so that the patients get that positive feedback and the confirmation. And this is the ultimate check and balance on me, because I know that I'm doing the job right and I continue to do it right. Now, as I get older, maybe one day I'll not be able to. I'm not going to do a mediocre job, because this is all or none. There are some patients that have come to me, they said, these are their words. They felt 60% better, 70% better, and they said, I swear there is something more remaining inside me, even though my surgeon says that he or she removed the entirety of the capsule. And this is where you know from your heart that because of the high definition videos, this is the surgeon is not augmenting, is only explanting, that no other surgeon's colleague under the same building or the same LLC or the same business is putting in implants. If you ask me, if your surgeon is doing BBL, that automatically, in my mind, nullifies him as even an ethical surgeon, because I will tell you, BBL, this is the Brazilian butt lift, automatically puts the surgeon in, quote, he's making fun of the human body category. He's mocking the human. I hear about this surgery that plastic surgeons are doing where they remove ribs and in order to contour the chest different. I will tell you, anyone who does that, I will not buy anything that they're doing or saying. I don't trust ethically anything that they're doing. If you ask me, now this is my take on this, but this is where you have to do your own check and balance homework, right? So I wish I could have every single surgeon have a Facebook page that openly allows for their previous patients to discuss, show pictures, high definition videos, and that there is complete back and forth transparency between the surgeon. So in my practice, because I see the patients come to me with residual capsules, these are surgeons who do not give high definition pictures. One patient even said, my surgeon showed me the high definition pictures and videos in recovery, and I don't vaguely even remember. This is not the time to show that. You should be, as a surgeon, proud. I have had surgeons that wrote down complete end block and the surgery was done in 36 minutes. We did a case last month. I have had surgeons that had a small incision and they said complete end block, virtually impossible. I have had surgeons that they said they did a total capsulectomy and the patients improved 50-60%, and they came to me, and then I did the residual capsulectomy only for them to improve completely, and it was never done right to begin with. This is where the surgeon has to meet two criteria. Number one, the surgeon has to be a firm believer, solid, from the bottom of their heart. One free soldier is better than 10 hired ones, which means if you fight from your heart, you're only going to do the surgery correctly with complete devotion, respect, sincerity, and honesty. And that you're talking about it, you're not augmenting, you're not capitalizing on having your colleague put an implant and you're claiming to be an explant specialist and sympathetic to BII. Deep down within, you're not a believer in this. The second so first is the belief, which is huge. Now, there are some surgeons who have taken that, okay, you know what, I'll believe for the next 4 hours because I'm going to be honest and integral and professional. Now, the second thing is you have to be able to show that you can do it. That is the other challenge, where you have to be able to show with the high definition pictures and videos and the patient's responses, high definition videos of cutting open, and you're doing a Facebook Live every single day, and your patients are all getting high definition pictures and videos of the chest wall showing complete removal, because that is technically very challenging and very invasive. It takes 45 minutes to an hour to put the implants in. It takes on average 4 hours just for me. And I use the word, I don't want to use the word fast, but I'm efficient. I take whatever time that I need to in order to doing the implants correctly. No matter what, there should be no compromise. I hear another surgeon that said, oh, the capsule was so thin, I left it behind and I just cauterized it. Not good enough. And the bottom line here is there needs to be complete, sincere removal of that capsule, and that is the take-home message. And that there is no second guessing the surgeon, because you know you have complete belief in the surgeon. Now, do you want to ask me any question?
Come prepared with any
No,
questions
on the
for
spot.
you.
Yeah.
Well, I understand that you're doing surgeries in California now.
Right, now I will tell you, there was such a high demand from California. There were so many patients there. And you know, I happen to have my California license and I have access to an operating room, Medicare approved, full certified facility. And for me, I said to myself, and this is what the patients told me, I've been thinking about it for a couple years. The patients come to me, they travel. Now, I'll tell you, they're so busy. I have had patients, believe it or not, that lived in Plymouth, which is 40 minutes, 45 minutes away. They saw me for the first time right here in clinic the day before, and they had their surgery the next day because they said, we just don't have the time. One patient last week from Massachusetts bought her day without even talking to me, and I got a text from Mar that said, please talk to her, her surgery is coming up. And I said, no, I will talk to her. So for me, I said to myself, even when I went to California, believe it or not, it was like getting on a bus. I did my work on the phone. I chatted with a friend of mine who was right next to me. I made a friend on the plane. And before I knew it, I landed. And literally, it was for me like I was doing a clinic right here in Michigan. It was nicer, prettier, and the mountains, and no one can beat California. And literally, I did the clinic. It ended 5:30 on that Saturday, and then I took the red-eye flight. I slept more on that trip than I normally do on a given day, believe it or not. And literally, Sunday, I caught up with my family, and then Monday, it was back to work again. So I hope to go there, do 3 cases in the clinic, and then this is where I hope to expand, hopefully one day, to Dubai. That's the plan ultimately. And this is where, you know, I have a patient coming from India. Now, I will tell you, if she takes a 3-hour flight to Dubai, she would take that in a heartbeat versus the 17-hour flight.
Right.
So, another patient that came to me from New Zealand. So this is kind of in the works. And hopefully one day I can teach someone how I do it. Now, remember, this has to come from the heart. One of my very close friends, he told me, can you teach me how to do it? I asked him one question. Are you still going to augment? And he said, absolutely yes. And I said, thank you very much. You have to do it from your heart. You have to do it from like you mean it, like the patient's post-op course depends on it. I remember all my patients. Another patient reached out to me after so many years. She said, I only trust what you have to say. And this was about even a non-plastic surgery matter. And I said, thank you very much for entrusting me, but I have no idea what to say because I'm not a general surgeon who does mesh hernia repair. And the bottom line here is you have to establish that bond. You have to do your homework. And on my end, the bottom line here is this surgery absolutely can be reproduced. So let me give you that example. And I don't believe in jinxing myself, but I will say this. Today's case that I did at the hospital was a case that I'll be frank and honest. I did not want to do the 89-year-old patient. I did not want to operate on the 71-year-old patient from today. She had a history of heart attack with stents. She had a history of a stroke. She's on a blood thinner Eliquis. And I got cardiac clearance on her, and she had what was a moderate to high risk, just like the other 89-year-old patient. Now, if you look at the patient, she sat in the same room. She was here. She came with her 2 best friends. She's 71. She has both ruptured right and left breast implants. She has grade 4 capsular contracture on the right and left. She has been given the cardiac clearance, and I'll tell you, no one should be in pain. And I knew from my heart, I had a choice to say, I'm sorry, I'm going to turn you down. And she's on the aspirin, by the way. So today when I operated on her, she is on the aspirin because I don't want her to get a stent. And the cardiologist said, I want her to be on the aspirin. And guess what? Right at the hospital, she took her Eliquis dose already. So I got a call from the nurse, and she already got her Eliquis which thins the blood because they don't want, because of the AFib and the stents. So I did not want to, and I will tell you, when I walked out, I looked at my first assistant and said, I'm not doing that again. Obviously, I was joking, and I've done a lot more involved surgeries. like the patient with the subglottic stenosis, the 42-year-old nurse with COPD, the very nice patient that I took care of that had the infected wound that I did almost 6 weeks ago. Another patient I did 3 weeks ago that was pouring out literally pus and an implant that literally was about to fall off. And this was a chronic open wound that she had since 27th of June that I just did. And she was the one who had that mass and the liquid on the inside. Now, these are all tough cases, but the bottom line is, if you do it in a very systematic, thoughtful way, she got the same surgery as you did, so that when she's resting on the pillow, she has no ruptured implants, no drains, and all of this was done in a very meticulous, calculated fashion. And I asked anesthesia, how is she, how's everything? We talked to the anesthesiologist who was there, and we did the surgery in a very controlled fashion. And the point here is, she's deserving the same health care as you, as I, as Mar, as anyone else would. Let me give you another example. I took care of a young lady in her 30s. She came from the Grand Rapids area. She had stage 4 breast cancer with metastases to her neck, getting chemotherapy at Columbus, University of Ohio, what is the second MD Anderson Cancer Center, the major cancer center for Columbus. And she came to me because she was having pain. No one should have to be in pain. And the bottom line here is, this is what it is important. Implants are not benign devices. Let me go ahead and read off 2 things. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are they will develop complications, some of which will require more surgery. Chronic pain syndrome, chronic fatigue, almost all the symptoms that you checked off. And not my words, these are the words of this same booklet that we have, that what are the risks associated, quote unquote, risks of breast implant surgery. Number 1, breast pain. Skin or nipple areola sensitivity changes or loss, asymmetry, impact of aging or weight change on the size and shape of the breast, infection requiring possible removal of implant, swelling, scarring, fluid collections, hematoma, tissue death of breast skin or nipple, inability to breastfeed, complications of anesthesia, bleeding, chronic pain, damage to surrounding tissue such as muscle, nerves, blood vessels. And then they want you to initialize over here. Then they talk about the BIALCL on page 12. Then they talk about that leaching of the silicone from the implant into nearby tissues. I understand that long-term risk of breast implants include painful or tightening of the scar tissue, which is the capsular contracture, rupture or leaking of the implant, wrinkling of the implant, visibility of the implant where it malpositions, shifting of the implant, need for reoperation, and then patient initials.
Is this the new paperwork?
Yes, and this is, and what is interesting is, they say over here, breast implants, certain labeling recommendations to improve patient communication, guidance for industry and Food and Drug Administration staff. It should say guidance for industry, Food and Drug Administration staff, and patients.
Yeah.
And then what it says at the top contains non-binding recommendations.
Oh my.
It's quote unquote. So all what you have heard today, Melody, and I cannot thank you. You know, I will tell you, someone reached out to me and said, and I'll end with this because I know I can talk to you forever.
Absolutely.
Someone told me, and this is a plastic surgeon who reached out to me from France. So by the way, I have plastic surgeons who follow me from Saudi Arabia, from Qatar, from Dubai. I have patients who tell me that they've reached me from Ghana and literally all over the world. So God knows who's watching this. But I challenge, and I say this in a very nice professional way. This, what I have read, are not my words. Sarcastically, I will say, I wish I was putting in implants. I would be 3 times richer, at least. My neck and back would be a whole lot better. I would have made it home at 3 o'clock today, right? After I get done, I have a lot more charting to do. Do no harm. All what I read today is harm. All what you said today is harm. The patient's own words. not worth it. I say to you, as a physician, as a clinician, as a human, as a plastic surgeon, as a general surgeon who's done a lot of mastectomies, lumpectomies, not worth it. Do your homework, go to the YouTube page, don't listen to me, listen to what the FDA is saying, what the manufacturers are saying, and most importantly, forget everyone, listen to what the patients are saying. They say two things: they wish they had never gotten implants, and they wish they had removed them sooner.
Absolutely.
And I'll let you finish, please.
Yeah, no, absolutely. I'm here to speak with anybody. I'm Melody Breton Lee on Facebook. If you want to send me a message, go right ahead. You can find me there. I don't really do a whole lot of social media, but I'm open to speaking with anybody. So feel free to send me a message if you have any questions. I'm happy to share more of my story with you.
Sure, and I just want to mention, in the world that we live in, when I was in medical school and I was in my training, I honest to God thought the world is like Mother Teresa. Everyone's super nice, everyone high-fiving and doing hugs. If anything, it's just the inverse. You want to do your homework, you want to do your research, and for completeness sake, one of my other phone consults that I did was an international phone consult, and someone asked, you pay your patients to talk? I just want to let everyone know, you and I have no financial agreement, right?
None at all.
I have paid no Facebook group owner, no Instagram owner, even though many other Instagram owners have reached me and said, please donate to us and we will put you up at the top of this list. And we will put an asterisk and we will supply you a lot of patients that you're not going to even want to do another Facebook Live. I said, you know what? If I needed the money, I would be doing implants, period. There is no bind. This is as pure as pureness can get. This is Melody coming here. Look, I even made her wait 1 hour. I feel bad.
Yep, I drove 3 hours with my husband all the way from the other side of the state of Michigan to be here, and I'm getting no reimbursement. Did this out of the goodness of my heart with Dr. Khan to help anybody and everybody that would like to save themselves the money and the trouble of getting these breast implants put in their body and going through half of what I went through.
Yeah, and there is no exchange of any. I just want to mention this very important. One patient in Portland, Oregon, I talked to, she said, there's another surgeon here who was on that list and he retired. Now I'm looking for other surgeons, so I wanted to interview. I said, what list are you talking about? And I said, who came up with the list? She said, there's a list I will tell you, there is no board of American explant surgeons. Everyone's kind of doing it their own way. This is all on the job training for almost all the surgeons. They're trying it and saying, hey, we're going to expand our practice. No one can authenticate another surgeon, especially if they have no medical background. We have recommendation list of surgeons. There's another list of top 10 explant surgeons that was floating around, and my patient came to me and is like, oh, you're a top 10, I knew you. I said, who came up with that list? This was another surgeon up to no good. He got together supposedly those 9 other surgeons, and they said they're the king, and he stuck his name in there, and now he's kind of with that group. And I will tell you, this is misinformation, wrong information. The ultimate and the only way you're going to authenticate that your surgeon is genuine, good, honest, phenomenal, whatever you want to say, is when you look at the surgeon's high definition pictures and videos, you talk to the surgeon's previous patients, and this is that Facebook group, an open discussion. Most of the surgeons, believe it or not, there is a surgeon, and many other surgeons right here in town, they say what happens in this room stays in this room. They make you sign a clause, or don't go out there discussing anything negative about us, because this is not what we're about. I say to you and to everyone, please go and record this conversation. Put it on CNN, ABC, CBS. I called the FDA and I said, please come shadow me in clinic, hear the patients directly so you can see firsthand exactly what is going on. Go join my Facebook page and see what exactly the patients are saying. Because you know what, ultimately, no one should have to go through this, especially now. We are going step backwards. Last year, the establishment micro-textured implants were introduced into the market, believe it or not, as the safe, nicer. There are so many surgeons saying you can get this surgery done under local during lunch hour. I'm not making this up. This is happening right now. There are patients that hold the implants and then they say this is the best gift to society and the safest implants that have had a proven track record. I will tell you, At the end of the day, if a cigarette is gonna cause lung cancer, the silicone, be it micro-textured with this new technology, ultimately it was only gonna be proven bad because they're made up of the same thing. They only will disintegrate. Are there long 20, 30-year studies that have been done on implants? No. And this is unfortunately the misinformation, misdirection that the higher authorities, the administration, unfortunately are allowing to, despite what we know, right? Ultimately from the patients.
And this has been going on since the 1960s, so I don't think it's gonna end anytime soon, unfortunately.
You know, the ban occurred in 1992 to 2007. If you ask me, it's only a matter of time before this is gonna go to a level where the FDA is gonna step up and say, you know what, we better do something about it, at least for their name's sake, right? Hopefully RFK is able to do something. He's thinking outside of the box. He's someone who understands this. I say to everyone, don't listen to me, listen to the patients, one after another. And you will see, if you see the complaints by the patients and in the masses, at least the FDA complaints that were made by the patients were 350,000. And if you Google this, you will see the patients are indeed coming forth. Look at how many Facebook group owners and Facebook group members are there looking for answers. This is what is a self-directed cure. You're your own advocate and you're making this analysis on your own and you're educating yourself on your own. So, all right, I'm gonna go ahead and end.
Okay.
All right, okay, thank you very much,
Thank you so
everyone.
much.
Please ask questions. We hope to do another Facebook Live soon. And thank you, Melody, for
Thank you, Dr.
making Self
Khan.
be here.
Thank you so much for
You're
having
welcome.
me.
You're
Appreciate
welcome.
you so much.
My pleasure.